Slide 1. Welcome to Health Management Information System. What is Health Informatics? This is Lecture B. The component Health Management Information Systems is a theory component that provides an introduction to healthcare applications and the systems that use them, health information technology standards, health-related data structures, and enterprise architecture in healthcare organizations. Lecture B will define the informatics team, their skills, roles, and responsibilities, and identify how health informaticians process data into information and knowledge for healthcare tasks with the support of information technology to improve patient care. Slide 2. The objectives for this unit, What is Health Informatics, are to define information management, information system, technology, and informatics, explain the basic theoretical concept that underlies informatics practice, define the meaning of biomedical and health informatics as a field of study. Slide 3. Additional objectives for this unit, What is Health Informatics, are to describe the biomedical informatics areas of applications, summarize the informatics drivers and trends, state the professional roles and skills of health informaticians, and identify how health informaticians process data into information and knowledge for healthcare tasks with the support of information technology to improve patient care. Slide 4. To begin to gain an understanding of the individuals involved with informatics applications and the type of work they do, let's first settle on what is the practice of informatics. According to the report, Training the Next Generation of Informaticians, the practice of informatics most generally requires the presence of two components. One, a set of skills and methodologic tools derived from knowledge of the basic informational and computing sciences, and two, knowledge, experience, and activity in one or more application domains. The coexistence of and interactions between these key components give meaning and significance to informatics as a field. Friedman et al., 2004, page 169. For example, many who practice informatics have training in the subject of human-computer interaction, an application domain covering how people use computers and how to design computer systems that help people use them more effectively. Slide 5. Taking into consideration the first component, a set of skills and methodological tools derived from knowledge of the basic informational and computing sciences, let's review the list of component sciences. Shortliff and Bloy, 2001, state that the sciences biomedical informatics draws on and contributes to include computer science, clinical science, basic biomedical science, cognitive science, bioengineering, management science, epidemiology, and statistics. Individuals working in the informatics field possess cognitive skills in logical and analytical thinking and have a technical understanding of the computing environment that is the basis for informatics work. Slide 6. The report, Training the Next Generation of Informaticians, also identified a second component to the practice of informatics as the knowledge, experience, and activity in one or more applications domains. Some examples of domains identified by Friedman et al., 2004, include cognitive and human factors and interfaces, data structures, database design, information retrieval, knowledge representation, networking and architecture, ontology and vocabulary, and software engineering. For example, a review of coursework at several universities on knowledge representation indicated the course covers how knowledge can be represented in a computer system and what kinds of reasoning can be done with the use of the knowledge. Slide 7. So, given the definition of the practice of informatics, who would be involved in this field of study? Practitioners of informatics. These individuals are known as informaticians. Members of the team vary in the types of skills, roles, and responsibilities, which in turn are tied to their level of education and experience gained through stages of career progression. For example, the team might consist of individuals with an associate's degree whose role is clinical data analyst, individuals with a bachelor's degree whose role is research and development scientist, an individual with a master's degree taking on the role of nursing informatics officer, and an individual with a doctorate whose role is chief medical informatics officer.